Hi, everybody. For Week's 10 Clinical Conference, we have JC, who is a 4-month-old male with a past medical history of Williams syndrome, supravalvular stenosis, and valvular pulmonary stenosis. And this intraoperative admission was complicated by a severe bivalvular dysfunction and hemodynamic liability requiring ECMO, and he was decannulated 9/1 and was discharged home, but he later developed supravalvular stenosis and long segmental arch stenosis requiring a Norwood-style aortic arch reconstruction, and that was on October 7th. So, since JC was last seen by the psychiatric liaison service, he has been able to wean off the scheduled Versed, which is at 0.058 milligrams per hour, as well as his scheduled morphine infusion of 118 micrograms per hour on 11/1. He is also tolerating his Precedex wing, currently at 4.72 micrograms an hour. JC continues with his scheduled Valium, methadone, and clonidine. However, he did require some PRN Seroquel at bedtime the past 2 nights due to increased agitation. On assessment, JC was lying in bed, calm, alert, and attentive, and tracking intermittently. He smiled intermittently as well. His tone showed no signs of EPS or neuroleptic malignant syndrome, and he was noted to have increased agitation at bedtime last night, which improved with the use of PRN Seroquel 5.2 milligrams, allowing him to sleep through the night. For his mental exam, his appearance was a male infant laying in the crib, dressed in a hospital gown and diaper and covered with a blanket. His behavior was calm, alert, and attentive. His speech, he's nonverbal. He's a pre-verbal stage of development, but he did have some cooing and babbling. His mood, we were unable to assess due to his age. Thought process and thought content were both unable to assess due to his age. He's only 4 months old. Orientation, also unable to assess. Attention, he was able to make eye contact with us and he was tracking intermittently. Memory is unable to assess. Fund of knowledge, unable to assess. Insight and judgment, unable to assess. So, in regards to his diagnosis, he is diagnosed with delirium, and Axis 2 is deferred. Axis 3 is Williams syndrome and supravalvular stenosis. Axis 4 is chronically medically ill and having frequent hospitalizations. In fact, he's only been home for a few days his entire life. And Axis 5 is 50. So the plan for him is to continue his PRN Seroquel, 5.2 milligrams at bedtime for restlessness and difficulty sleeping. He did receive a dose on November 1st and 2nd at bedtime due to increased agitation at night. We will also continue to wean off his Versed and morphine as it is tolerated, as well as the Precedex drip wean. I found a really interesting article that talked about treatment for delirium and how antipsychotics can be used to treat potential cause of delirium. And for this particular kiddo, he's been in the ICU. When I was counting his meds, as I was putting him in Typhoon, he's literally on 27 meds. And reading up on delirium, delirium is actually a dysfunction of the brain. It's not a disease and it's not damage, it's dysfunction. And the only way to treat delirium is to treat the actual cause. Different causes of delirium can be infection, it could be side effects from medications, and it could be brain damage, but there's many different causes. And a lot of times when during my clinical setting, it's caused by medications and or not being able to sleep. I found a really good article that talks about antipsychotics such as Seroquel that can help treat the potential cause of delirium. And it says that currently, although there's no FDA and Drug Administration approved medication for the management of delirium in adults or children, however, there is a robust body of literature that supports the use of antipsychotics as a first line for symptomatic management with growing use of alpha 2 agonists and melatonin as adjunctive pharmacological interventions. And also, just a refresher in regards to Seroquel. Seroquel is a second generation antipsychotic, and it works by blocking dopamine 2 receptors, reducing positive symptoms of psychosis and stabilizing affective symptoms. But at the same time, it also blocks serotonin 2A receptors, causing enhancement of dopamine release in certain brain regions and thus reducing motor side effects and possibly improving cognitive and affective symptoms. So, okay, thank you so much. Let me know if you have any questions.